Hello, everyone. This week, Syamala and I are going to present to you what we have found out about insurance industry so far. As you can see from the title, it's a bit of a train wreck, especially in the United States, but we'll get to that later. And before that, we will share our personal stories regarding health insurance. For those who don't know, I grew up in South Korea. I spent the first 19 years of my life there. And growing up, I didn't really have to care about health insurance. Although South Korean national health insurance is not perfect, and a lot of people actually still add on private insurance. But at least everyone had something because of the universal single payer health insurance system. I actually didn't know it was possible for a person to not have health insurance until I came to college. And when I came to college, I was on a student health plan, which wasn't bad, but there were quite a few noticeable differences. One thing that could be good or bad was that people here seem to have primary care doctors. So a lot of my friends would say, "Oh, I need to go see my doctor," whereas that concept is entirely new to me. Like you can go to any doctor's office and you will get the same treatment, and they're generally good. So having like my doctor, having that relationship-based service was really fresh and appealing. And since I know now that primary care doctors reduce unnecessary visits and direct patient to the right specialist, I thought it was a really positive thing. The idea of family medicine and having a primary care doctor is actually becoming more of a popular idea in Korea. So in that sense, US is ahead of the game in that. But having your primary care doctor also means here that you are tied to a region or a network, which is extremely limiting as well. Um, so there are both sides to it, but that was one noticeable difference that I saw in health insurance. And in general, sadly, the copays were much higher when I was in the United States. And for most of my friends, the first choice when they get sick is to hope to heal naturally. They just like their natural response is to like try to not go to the doctor's office. And I've rarely seen anyone around me seek preemptive care except some of my professors who have very young children. And I think this is not a good psychology that we're sharing here in the United States. Yeah, so that was me when I was growing up. And now, after graduation, I'm having my first gap in insurance before starting to work full time. I'm going to soon have a full month, a little more than that, of being uninsured. And having having had continuous health insurance my whole life, this is quite terrifying. And I'm glad I'm healthy, but it is pretty scary to have that prolonged period of time without health insurance, especially when the global pandemic is happening and I'm living by myself. So if I don't know, if I faint and like fall to the ground, who's gonna like take me to the hospital and whatnot? And with everything that I'm seeing from the news these days, even if I have this short term health insurance, I really cannot be certain if the medical facilities around me have the capacity to give me the service and treatment that I need on time. So all of this mess in the US health insurance system really shocks me at how people can tolerate the situation. But at the same time, I know that I come from a very privileged environment where we have universal health care. Yeah, so that was my rough impression of US health insurance. Yeah, and next up, Syamala will be sharing her story about health insurance.
Great. Thanks, Hyunmin. Similarly to Hyunmin, I feel like even though I grew up in the US, I didn't really think about health insurance like growing up. I mean, who really like thinks about health insurance when your mom can just like schedule all your appointments and like just yeah. So didn't really think about it much. But of course, yeah, when I went to college, that was like a consideration. My mom was working, so she got insurance like through her job. So I was just planning on staying on her insurance when I was in college, but unfortunately a couple months into the school year of like my very first year of my very first semester, my mom lost her job and she was then unemployed, and then we didn't have health insurance. And so there was like a few weeks, just a few weeks, where I was kind of in this limbo of not having health insurance because I wasn't able to get on my school's health insurance right away because there was like some processes there. I'm also a low income student, and like it meant like taking out more of a loan to be on the health insurance. And I was just kind of in this limbo area. And while we were like trying to figure it out, my mom, I had Medicaid in Illinois, but I didn't have Medicaid in Iowa, and just so many complications. But basically, the worst nightmare of someone who experiences a gap in health insurance ended up happening. I got a really bad like skin rash on my face, and it was like something that I had never had before. It was completely new to me. I had no idea what was happening or why it was happening. And I remember going to the health center on campus, and they told me, well, you don't have health insurance right now. You need to go to the hospital if you want to see a doctor because the emergency room can eat the bill. And so I visited the ER 3 times in 1 week before I finally decided to go home back to Illinois and actually see a dermatologist because my family was on Medicaid in Illinois. That's kind of my kind of like horror story with health insurance, and just like the struggles that it imposes on people. And like it happened to me and my family, and like I said, we're low income, and that was a huge factor, and then my mother lost her job, and that, people lose their jobs every day. So that's kind of why I was very interested in learning about why we have the current system that we have, and yeah, where it came from and what we could even do to make it better. But yeah, that's why I'm interested in it. I think Adam is going to share next about his experience.
Yeah, my experience also involves ER utilization, but I mean, I just have to wonder aloud. I mean, uh, an academically talented student moves one state away, and like imagine if you lived in Rockford, Illinois, and you wanted to go
Right.
to you wanted to go to school in Davenport, Iowa, like a
Mm-hmm.
20-minute drive away. You would
Yep.
not be covered by health insurance. Yeah, that seems really appropriate in 2020.
Yeah. Yeah. I believe this was in 2017. Yeah.
Oh, okay. Well, ancient history then.
I know, right? So long
Yeah,
ago.
things are probably a lot better now.
No, you're right. Right.
All right. So my story starts with my baby girl sleeping peacefully in her bed, as she always has done because she's a gifted prodigy who sleeps 13 hours a night. Not because of anything we did right. She's just amazing. My baby was sleeping quietly. She's maybe a year old at this point, and wakes up sweating and coughing and crying and shaking. And that shaking was what really got me. I mean, we had seen our kid wake up crying before. Usually she was hungry, or maybe she had gas or something like that. But nothing like that seemed evident here. And we waited a couple minutes for her to calm down, and nothing worked. And she's just getting more and more worked up, and the sweating and the shaking, and couldn't shake the idea that, well, maybe this was something serious this time. So what did I do? Got in the car right away, and we drove to the emergency room. And then we did what every self-respecting American citizen does at the emergency room. We waited for like 3 hours. And then we were dispensed some acetaminophen because they had no idea what was wrong with her either. And at the end of the day, she eventually became calmer, not because of any medical intervention, not because of anything I did to calm her down. Just whatever was making her feel bad was feeling a little less bad, and I'm sure the placebo effect of the acetaminophen didn't hurt. And so at that point, the doctor said, "I don't see that there's a lot more we can do here, Mr. Lorton. We're going to send you home now." And so we still have no idea what was wrong. We think she was probably constipated. Babies are like that sometimes. And what I want to go back to is the decision to go straight to the emergency room. It was the middle of the night. We knew that we would get relatively fast service. You know, it's still the emergency room. Emergency rooms don't move very fast. But because I had good health insurance at the time, I knew that I was going to pay $125 for that. And, you know, it was never fun to pay $125 to sit around waiting for a doctor who has no idea how to help you eventually administer some acetaminophen, which you have plenty of at home. But it's a lot more palatable than it would be for me today, because today I'm self-employed, and self-employed people, there's a lot of differences in how the insurance works. So I would probably pay $1,000 for that same thing instead of $100. That's nearly 10 times as much.
Wow.
And so if that same situation arose today, I think instead of waiting 5 minutes to see if her condition improved, we might wait 60 minutes. And if she actually had a serious health condition, those 60 minutes might have been an issue. And I'm a privileged person who can afford an unexpected ER bill of $1,000. Not everybody can. And so the state of health insurance is, I'm going to go with sucky. And this really illustrates a stupid, unfortunate dichotomy in our society, which is the difference between employees and entrepreneurs. So if you are an employee at any halfway decent, self-respecting company, it works like this. They hire you, and then you pick from maybe 2 health plans. Then the company pays for 75% of your health insurance. You pay for the other 25 out of pre-tax money that you never even see. They take it out before the money even goes into your bank account. On those good health plans, almost all your care is covered. So like you go to the doctor, $20. The emergency room, $100. Your company might even have a medical liaison to help you navigate a more complex care situation. So that's all really nice if you're an employee. But there are some other things that go with being an employee, like your boss setting your hours and you making the same amount of money, whether you're mediocre at your job or amazing at your job, you know, in the short term. Over the long term, you can get paid more. There's the autonomy piece. If you own your own business, you get to make your utopia where you set the rules for like what is the perfect place for you to work in. And that was why I did it, because I chafed under my bosses for 10 straight years. And then I thought, what if I could chafe under my own leadership? And so I did it. But my reward for doing that was, yes, I control my time. I have unlimited earning potential, upward and downward, could go all the way to 0. And I have the autonomy to set the rules at my own company. So that's all great. And in exchange for that, I get to go to the health insurance marketplace and I get to pick a plan from hundreds. This is what we call a confusopoly, where there are hundreds of options that are not clearly differentiated from each other, that are all where it's not clear what you're paying for, and and so I'm paying more like $1,000 a month for much worse coverage. If anything bad happens to me or any member of my family, we're going to pay $6,000, which I think is our deductible this year. An emergency room visit, not going to be covered at all. We'll pay the full $1,000 or $1,800. Heaven forbid we need a CT scan. And every time there's a little thing, like I'm a person who values my health. And so if my doctor recommends but doesn't require that I get a lab test, I'm going to go get that lab test. If my doctor recommends an x-ray, I'm going to get that x-ray. And then I'm going to see that as a line item on the bill 30 days later, because you can't just pay with a credit card right then and there. But having to decide, what do I want more, $150 or my health? It seems like in a place where we want to promote health, where, by the way, promoting health at the age of 35 can save thousands, maybe hundreds of thousands of dollars down the line if a person stays healthy their entire life. You would think that we would want to encourage people to proactively manage their health, which would make them less expensive to insure in the long run. And so having them make those unfortunate kind of financial decisions in the short term doesn't seem like the way to do it.
I
Agreed,
cannot agree
Adam.
more.
Okay, I'm going to step down from the soapbox and I'm going to let you guys resume your presentation.
No, thanks, Adam. Thanks for sharing that story. Yeah, and kind of going off of that, like, yeah, we all have these stories like surrounding health insurance, and it seems that every person in the US right now has a story of their own. Like, which begs the question then, how does the health insurance like really work in the US? And like, of course, Adam started talking about it a little bit. But we have a multi-payer system where some people will get health insurance through their employer, which is usually a private insurance. Some people will get health coverage through government sponsored programs, but believe it or not, there are millions of Americans who are currently uninsured. To which you'd probably respond, but what about Medicaid? You know, and what a great question. What about Medicaid? This is exactly what Medicaid is for, right? Medicaid is a government funded, subsidized health insurance, as it requires some co-payments, deductibles, and premiums for some. But under Obamacare, people were split into two groups. So the bluish purple, blue, we're going to say blue. The
Looks blue
blue,
to me.
okay, cool. The blue half being slightly financially weller off population of people who are eligible for subsidized insurance, and the red half being population of people most financially vulnerable to healthcare expenses and debt. However, after the Supreme Court ruled it was unconstitutional to require states to expand Medicaid, 20 states opted out, making people fall into what is called the Medicaid gap. So Americans across the board, low income, high income, healthy people, unhealthy people, are opting out of health insurance because the premiums are just getting too high. Laws actually prevent insurance companies from charging more money to the sick. So the cost for healthy people goes up. And then people are tempted to enroll in cheaper insurance or just do without it. And according to the Commonwealth Fund, 41% of working age Americans have medical bill problems or are paying off medical debt. And I'll say that again, 41%, which is an insane number of people. 41% is so many people. And the situation, of course, is only made worse by COVID. In 2018, according to the US Census Bureau, 8.5% of people, or 27.5 million people, did not have health insurance at any point during the year. And according to the Commonwealth Fund, 43.8 million people are underinsured. And the uninsured rate and number of uninsured increased from 2017. And uninsured working age adults in the United States were disproportionately low income, and Latino, and under the age of 35. The Urban Institute and the Robert Wood Johnson Foundation projected that by the end of 2020, 10.1 million people will no longer have employer-sponsored health insurance or coverage that was tied to the job that they lost because of the pandemic. And according to Families USA, these recent increases in the number of uninsured adults are 39% higher than any annual increase ever recorded. Again, 39% higher than any annual increase ever recorded. And I know I'm literally just like listing like percentages right now, but I feel like the numbers kind of speak for themselves in terms of like how many people are severely severely impacted and affected by health insurance debt, and are losing health insurance consistently. And then even during a pandemic, you know, when people need health insurance most, we're seeing millions more lose their health insurance. And like, these aren't small numbers of people, they are millions of people in the country. And these record-breaking increases in the number of uninsured have taken place, during the country's worst public health crisis in more than a century, and the sharpest and deepest economic downturn since World War II. And it's a pandemic where Americans are at high risk of catching a life-threatening disease and are losing the health insurance that could save them, essentially. And the government is responsible for lives that are being lost since no federal COVID-19 legislation has been signed into law.
Wait, stop it. Of course, there's been federal law around COVID. They bailed out they've sent trillions of dollars to businesses who have been affected by this.
Yeah, see, trillions of dollars going to businesses doesn't necessarily mean that those that money is going to the workers or the employees. And that is the point, right? So yeah, and no like federal COVID-19 legislation like has been signed into law to attempt to restore or preserve comprehensive health insurance. And one option to help the American people in terms of like health insurance would be helped by universal health care, which Hyunmin will talk about next.
That was a pretty smooth transition.
She got you good.
Yeah, so we have looked at the uninsured population, a gigantic uninsured population in the United States. And the natural question that follows is, how do we become this? And why do we not have universal health care? So we want to take some time to look at how US health insurance system came to be the way it is by looking at the history and seeing what kind of obstacles that the United States of America have to get to universal health care. So as you all know, there has been a consistent politicization of healthcare in the United States. And regards to health insurance, President Truman proposed public health insurance for the first time in 1945. And that's a great thing. But it got rejected by multiple people, multiple organizations, including the American Hospital Association. I don't know why. So after that got rejected.
Well, sorry, I apologize. I'm going to briefly interrupt you. The American Hospital Association was also opposed to racially integrating hospitals. So it would not be the first time that the AHA was expressed an opinion that's unpopular in this room, at the very least.
That's something that I would never come to understand. But, it's what happened. So, yeah. So Truman's proposal for public health insurance was rejected. But people still needed health insurance. So instead of jumping into a long and arduous political battle, people started to advocate for employee-sponsored health insurance as like the next best option. So that's how the employee-sponsored insurance became a big thing in the United States. And in 1965, President Lyndon Byron Johnson signed Medicare and Medicaid, which is great, but it's also for the extremely poor people and the older population. So the middle class population and the low income population still don't have any safety net, except for private health insurance and employee sponsored ones, which might not be available to everyone. So it's been like that for some decades until in 2014, the Affordable Care Act went into effect. So that was when all individuals were required or incentivized / penalized, depending on whether they had health insurance or not. And a lot of people became insured after the enactment of the Affordable Care Act. But then in 2017, there was the Tax Cuts and Jobs Act, which repealed the ACA's individual mandate. So the number of uninsured people went up. You see, not mandating insurance enrollment affects the uninformed and underinformed. In particular, for example, Latinx people who didn't know about their eligibility of health insurance at all, or those who just consumed information about the Affordable Care Act through adverse Republican TV ads, and they would oppose to Obamacare but accept Affordable Care Act, which is a really bad situation. It also adversely affects people in general because the costs incurred by the uninsured eventually have to be absorbed by the insured via increasing premiums and co-pays. Yeah, so the US is yet to achieve universal health care, and then now we have the pandemic in 2020. So that's the history of US healthcare. And then for the United States of America in particular, there is one layer of obstacle that is worth mentioning, which actually has to do with the psychology of people rather than any policies or numbers. The people in America seems to be fundamentally obsessed with the concept of individual freedom and free choice, which is great, which is great. Like there are so many countries around this world where they don't have, free press. Maybe we don't have it here now, but there's a free press, and there are lots of good things that come with the free market. You incentivize innovation and whatnot, but it also hinders things like Affordable Care Act from, taking its full form. Conservatives in the United States oppose government involvement, and most US citizens don't trust their government. And people from left and right are unhappy about the individual mandate in the Affordable Care Act, which requires everyone to have health care. So the fundamental belief in individual choice in America allows people to make hate speeches or tell blatant lies on media. It allows people to possess guns. It allows people to be unabashed about not wearing masks for public health, and not to mention the whole health insurance debacle that we have here. So this matter of individual choice in the United States makes me doubt that the US is ever going to achieve universal single-payer healthcare. But then again, there are positive waves of changes happening here, so I do have my hopes up.
So what now? Right?
I appreciate you guys painting such an optimistic, rosy picture.
I mean, hey, we're just keeping it real, right? Like, so according to the Commonwealth Fund, 23% of Americans say that the health system must be completely rebuilt in the United States. And that is more than twice the percentage of people for other countries, similar to the US. And some argue, again, that universal health care would limit Americans' right to choose their health care. But the truth is, most of us don't even really get to choose our health insurance. And we get it from our employers, and the current system limits Americans' choices far more than it expands them. As we've seen, there are many holes in our current system, such as that leave everyday people vulnerable. Something like changing jobs. Adam talked about being self-employed. Going out of your insurance network can be really, extremely expensive, and people can get charged thousands of dollars if they call the wrong ambulance or go to the wrong hospital or have the wrong doctor. And under Medicare for All, of course, there are some concerns surrounding raising taxes and how to impose the taxes to pay for it in an equitable way. Cost is a lot more complex than just we're raising taxes now, but then also having to compare the cost of raising taxes versus money saved on not having to pay for as nearly as much for healthcare expenses. And then, of course, eliminating the private health insurance industry could displace over 1 million workers. And those are a couple legitimate concerns surrounding Medicare for All and universal health care that should definitely be taken into account. These are also some other policy recommendations from the Commonwealth.
Would it be okay if we just dive into that one for a quick second, though? Because, yeah. All right. So, first of all, Hyunmin already made the point. Americans would never give up private insurance. So let's say that there is a sweeping regulatory change where suddenly there is a Medicare available for all, or maybe Medicare given to all. Even so, there's going to be a private insurance market. So private insurance won't go away. It'll be a smaller portion of the market. And then if you want to think about, sorry, now I'm really getting on my high horse, but yeah, if you want to think about what do the smart economies do? Well, they think about how they want to allocate their workforce. And is having millions of people working in the health insurance industry a boon to American productivity? If half of those people instead were working in renewable energy or working in AI, do you think that would be better or worse for the United States? I think no offense to the individuals, because I work with a lot of those individuals and they're really nice, competent professionals. I think that if they were working on something more useful than health insurance, by the way, duplicating the work that people in other states, people in other countries, people in the federal government are already doing, duplicating all that work 50 times for 50 states times several insurance companies per state. That is wasteful, and those intelligent people could be doing more good for this country and this world if they weren't working in health insurance.
Wow. That yeah, that's really interesting. Yeah, like the distribution of like workforce is something, yeah, that like seems to come up a lot, even like in terms of like immigration. I know that that's like a big argument of like they're taking all our jobs, but it's like clearly more nuanced with that than that in from the economics perspective. But yeah.
I have a question.
Yeah.
So you said like they're duplicating the work
Yeah.
unnecessarily, but when the Affordable Care Act came into effect, didn't they let people shop for insurances? So like the private companies and Medicare, Medicaid, or whatnot, like they would have this competition so that they provide better plans for people. So wouldn't that be bringing like more positive effect to the general public? And like I feel like over time things would kind of get whittled down and
Oh,
like reach an equilibrium. I don't know. Yeah.
I'm so ready for this one, Hyunmin. You have no idea. No, competition can drive prices to the bottom when quality and price are clearly differentiated. But in the case of health insurance, it is very difficult to tell which plans are worth more money and which plans are worth less, and what coverage is worth more and less. It's a confusopoly. And so if you're in a situation where consumers don't want, so actually quick side note, I know a guy who runs an online education company. So he sells online courses. And so he sells, courses on how to become a freelancer or how to save more money. And one of the courses he offered for a short time was how to choose the right health insurance plan, because he knew health insurance is such a huge pain point. And he quickly shut the course down because he figured out that people hate choosing their health insurance plan. It's like torture for them. And so it's such a bummer that they just want to get it over with. And so if there's an important multi-$1,000 decision is so painful to you that you just want to get it over with, what makes you think that these consumers are doing the research to find the right plans and reward the insurance companies that are actually offering a better deal? That's just not happening. And so I wouldn't be surprised. You could make the argument, I'm sure, that the situation has improved since the passage of the Affordable Care Act. And my answer is too little.
Well, what do you think about the introduction of services like Policy Genius? So there would be like an intermediary company or like, entity that would compare all the plans for you.
I like it. I think it stinks that the decision is so complicated that it requires a third party to analyze the options for you. But I'm glad it exists.
Okay. So Syamala and I researched about health insurance, and the things that we have found is that in the United States, there's a huge problem of misinformation. People are suffering from the illusion of free choice, which actually takes away choices from people, especially in healthcare. And it became more and more obvious that government support and action, which happens through people's choices and actions, they need to precede any strategy that a single company or provider can take. And I know Adam would object. There are a lot of things that other players could do, but government support and action would help immensely, especially in this country. The United States is the only, one of the only few, maybe the only place where healthcare is politicized. Although it'd be great if one day some deity comes down and resets American health insurance system to universal healthcare, it's probably not going to happen. So if it takes politics to put things on the right path, then we do politics to put things on the right path. And so that's why we are concluding this presentation with a call for action. So for instance, the November presidential elections can have a huge impact on US health insurance. Every American, rich, poor, like whatever ethnicity you are in, they're struggling with, or at least annoyed at, the issue of medical expenses, debt, and lack of affordability in care. And complex health insurance systems are keeping Americans unhealthy and in some cases, like now, making Americans lose their lives. So we need to realize that health happens not only by taking care of ourselves, but also others. And I feel like the hurdle of individual choice and individual freedom, like, we just need to get over it, especially when it comes to healthcare. So we urge everyone to pay attention, take action, like vote, and do what it takes to put the health insurance system on the right track.
Well, thanks, guys. Great work. And yeah, I mean, hard to disagree with any of your conclusions there.
I noticed you reacted when Hyunmin said that the U.S. is the only country in which healthcare is politicized.
I am skeptical of that point, although I don't know it for sure. I mean, I'm friends with people from England, and I feel like, you know, the way their healthcare would be politicized would be different. As in, like,
It's like over
the NHS sucks. Nah, the NHS is okay. But like, but it is certainly not politicized to as much as our healthcare system is.
Yeah, I guess that's what I wanted to tell, because even in South Korea, there are political dialogues. There's a discourse on health insurance, and the problem we have is that people overutilize it.
Right.
There are people who just like casually shop for medicine or like casually shop for medical stuff just because they can, and it's a huge bill. So I think Korea is actually on the process of like making it more efficient. I don't think it's ever going to go private. People are going to, like do another like big protest. But yeah, so there are politics attached to healthcare in every country. But what I wanted to say about the United States is that it shouldn't be this bad.
Well, and one would hope that we could agree on some of the basics, like, for example, what's more important for us to have lower taxes in year zero, or what's more important, or to prevent the United States from going bankrupt over healthcare? I feel like the latter is more important to me. If someone told me it took slightly higher taxes in year zero in order to achieve healthcare not eating up our entire economy, I would consider that worth it. And actually, so one quick optimistic note, and I've shared this with you guys privately, is that even absent any government action, I do think the situation's going to get better, because at least what I'm seeing here in my little corner of Michigan is that healthcare providers who have historically been really resistant to the slightest change in reimbursement are embracing population health and are embracing risk-based contracts that are getting the incentives aligned properly for the first time ever, so that instead of being incentivized to wait until people get really, really sick and then treat them in the hospital, we're incentivized to intervene early and keep people healthy from the beginning. So I don't think it will fully solve all the problems you guys outlined in this presentation. I am still encouraged that the people with the poorly aligned incentives for all these years are actually really nice people who want to do right by the patients, and because of the poor legal structure in place have had a hard time doing so up until now, but they are starting to figure it out. I think the government could accelerate that change, could accelerate it a lot. And even if the government does nothing, I'm still optimistic that 5 years from now, it'll be better than today.
Yeah, I do agree. And I feel like the changes and innovations that are happening in healthcare in the United States, that those things would never take place in, say, like in South Korea. And I feel like having this deprivation like makes people come up with like really great solutions, although they may be like more patchy than supplemental. But it's also because things are so bad. Like it took millions and thousands and hundreds and thousands of lives for people to do this and like make this change. And I don't think, I mean, it's already happened, but I personally find it unjustifiable. And I think it's just really important that people do whatever they can to not lose more lives.
Okay, really quickly before we sign it off, I want to do a really quick round robin. Your favorite health innovation that you can think of. I'm going to go first, and my favorite health innovation recently is Magic Spoon cereal. It's low carb cereal. Yep.
Why Magic Spoon specifically? There are so many low carb cereals out there.
There are? Oh, okay. It's the only one I knew. It's the only one I knew of.
Oh.
Anyway, this thing that I loved to eat as a child that is just really, really bad for you can suddenly be be not unhealthy to eat. So that's my favorite health innovation. Who would like to go next?
I really like telepsychiatry.
Mm.
That counts as an innovation. Because when I was in Grinnell, we only had, or still have, like 2 counselors. So I think all of my friends had to go to a person in town, or they had to do a telepsychiatry with like a person in University of Iowa. But that was better than nothing. And I know a couple of my friends who got immense amount of help, and sometimes they would go into their office, although it takes a little bit of time. So, like being able to get treatment that you would otherwise not have gotten, I think that's great.
Nice.
I would probably agree, honestly. I'd probably say telepsychiatry, mostly because I can't really think of anything else, but I really like that one, so I will jump on that with Hyunmin.
Good deal. Mm-hmm. All right. Thank you, guys. This was Syamala's last presentation. Give it up for Syamala.
Thanks, fam. Yeah.